The Emergency Department Telehealth Service operates after hours in the Hume region of Victoria, using synchronous or real-time video conferencing technology. This equipment can connect patients at urgent care centres when no on-call GP is available with doctors at a regional emergency department. This video will take you step by step through the processes and procedures in using the telehealth system, which has been developed at North East Health to ensure telehealth is a consistently safe and high-quality medical service to patients.
The patient presents to the urgent treatment room in this facility. We do an assessment and then we decide what triage code. If they're at triage 4 or 5, then that's the time we can use the telehealth program. In addition to the usual documentation, you must complete an ISBAR referral for the telehealth consultation, as opposed to the urgent treatment room ISBAR form. The ISBAR form basically contains a brief overview of the patient's story and reason for presentation to the urgent treatment room after hours. The ISBAR form is then emailed to the emergency department at the regional hospital. We then go and telephone the reception at the emergency department at the regional hospital and advise them that we have a patient presented and that we have emailed the ISBAR form over to them.
Good afternoon, Emergency, Jane speaking.
The reception then gets the email off and she advises the triage nurse, usually who then talks to us immediately, and we then give them the presenting history.
Now, you there, Deb? I've just received your ISBAR sheet, the email. Now, I'll just confirm some details. I'll just page the...
The triage nurse will give us some idea of how long before the patient will be seen in the virtual emergency department. Sometimes that can be quite quick, depending on the acuity of the patients in the regional facility. We then keep the patient here, take care of them, monitor, do observations until we receive the phone call that the doctor is now ready to do the telehealth. The patients are quite happy to remain here, even if it is a wait. It saves them either a trip in an ambulance or a trip in their own car. They're much more comfortable in their own facility, in their own town. The doctor from the regional facility always telephones to advise us that they're about to link in to interview the patient. So we come in, we tell the patient that doctor's on the other end and get them set up and ready. Good evening, Doctor. I'm Debbie, from the registered nurse from Beechworth. Doctor, I'd like to introduce Terry to you. Terry's presented tonight with an acute exacerbation of neck pain. And then we stay with the patient. You don't necessarily have to stand beside the patient and over their shoulder, but just in the room, so that if the medical officer on the other end has any questions that he wants to ask. During the telehealth consultation, the registered nurse continues to maintain the documentation and progress notes throughout the session, and often the patient will have asked questions, but in the interview forget a few things because they get a little bit anxious, and we can just intervene, or sometimes the doctor will ask the registered nurse, do you have any questions? And you can just say, yes, well, Mrs. Smith did mention to me earlier XYZ, and then he can take it up with the patient at that time. The best place for the Pract Cart is to be closest to either where the patient has an injury or to the side that's most comfortable for them, given their mobility or ability to move around. We have no need to operate the camera at all. That's done remotely by the doctor at the receiving hospital. Medication orders are similar to telephone orders in that the doctor gives you the order verbally via teleconferencing. After the consultation is completed, those orders are then emailed over to us on the doctor's consultation notes. The written medication orders from the doctors will be emailed to us from the regional hospital immediately after the consultation.
And then emailed off to Beechworth. We're done.
Great.
It's finished. Thanks a lot.
I don't believe anybody should be afraid to use the telehealth conferencing. It's an absolute wonderful innovation. I'm an absolute convert. I've seen it used in many settings. It's very successful, medico-legally sound. It is just wonderful, and I would encourage everybody to give it a go. Once you've used it a couple of times, you become confident, and the patients actually really like it. They see it as a great innovation in healthcare for them. They can stay in their local communities, and they're being seen by emergency doctors. It's a huge support for registered nurses, particularly in rural settings where often you may not deal with things on such a regular occasion. You're not really sure, but you get on the telehealth, talk to a doctor. It's very reassuring and very protective. I'm a great fan. I think it's a wonderful innovation, and I think that it has lots of benefits in the future.